A structure further from the point of origin is said to be distal, proximal, medial, or lateral. Distal. Distal means further from the point of attachment or trunk. A structure closer to the point of origin is said to be proximal, distal, lateral, or medial. Proximal. Proximal means closer to the point of attachment or trunk. The sternum is what to the heart? Anterior, posterior, lateral, or inferior? Anterior. The sternum is anterior to the heart, as it is in front of it. It is also more superficial than the heart. The vertebral column is what to the sternum? Posterior, anterior, medial, or superior? Posterior. The sternum or breastbone is on the anterior or front side of the body, and the vertebral column or backbone is on the posterior or back side. The umbilicus is what to the surface of the body? Anterior, posterior, superficial, or deep? Anterior. The umbilicus is on the anterior surface of the body, which is another term for the front. It is located on the abdomen and is sometimes also called the ventral surface. The shoulder blades are what to the surface of the body? Posterior, anterior, inferior, or ventral? Posterior. The shoulder blades are on the back side of the body. The little finger is what to the thumb? Medial, lateral, proximal, or distal? Medial. Use medial and lateral to describe their position relative to the body's midline. The little finger is closer to the midline. Avoid distal and proximal as they describe distance from the trunk, and in the anatomical position, palms forward, the fingers are at the same level. The thumb is what to the little finger? Lateral, medial, distal, or superficial? Lateral. The thumb is further from the body's midline. The nose is what to the cheeks? Medial, lateral, superior, or inferior? Medial. The nose is closer to the center line of the face. The ears are what to the nose? Lateral, medial, posterior, or anterior? Lateral. The ears are further from the center line of the face. The skin is what to the muscles? Superficial, deep, proximal, or distal? Superficial. The skin is closer to the surface of the body. The bones are what to the skin? Deep, superficial, medial, or lateral? Deep. Bones are further from the body surface. The elbow is what to the wrist? Proximal, distal, inferior, or superficial? Proximal. The elbow is closer to the point of limb attachment or shoulder. The fingers are what to the wrist? Distal, proximal, superior, or posterior? Distal. The fingers are further from the point of limb attachment. The knee is what to the ankle? Proximal, distal, superficial, or posterior? Proximal. The knee is closer to the point of limb attachment or hip. The hip is what to the knee? Proximal, distal, inferior, or lateral? Proximal. The hip is closer to the point of limb attachment or trunk. The head is what to the neck? Superior, inferior, anterior, or posterior? Superior. The head is above the neck. The chest is what to the abdomen? Superior, inferior, deep, or superficial? Superior. The chest is above the abdomen. The pelvis is what to the diaphragm? Inferior, superior, medial, or lateral? Inferior. The pelvis is below the diaphragm. The feet are what to the knees? Distal, superior, proximal, or inferior? Distal. The feet are further from the point of limb attachment than the knees are. A sagittal plane divides the body into which sections? Right and left, anterior and posterior, superior and inferior, or proximal and distal? Right and left. It is a vertical plane that divides the body left and right. The mid-sagittal plane is what type of plane? Median, horizontal, frontal, or oblique? Median. It divides the body into equal right and left halves. It is also known as the median plane, as it runs vertically through the exact midline of the body. A frontal plane, also known as a coronal plane, divides the body into what sections? Anterior and posterior, right and left, superior and inferior, or medial and lateral. Anterior and posterior. It is a vertical plane that divides the body into front and back parts. A transverse plane divides the body into which sections? Superior and inferior, anterior and posterior, right and left, or medial and lateral. Superior and inferior. It is a horizontal plane that divides the body into upper and lower parts. The heart is what to the lungs? Medial, lateral, superficial, or deep? Medial. The term medial means toward the midline of the body. Even though the heart is off-center, its entire structure is still closer to the midline than the entire structure of either lung. The arms are what to the trunk? Lateral, medial, proximal, or distal? Lateral. Lateral is correct because it describes the position of the entire arm relative to the body's midline. We avoid distal because that term is used to describe positions along the length of the limb itself, not the limb's attachment to the trunk. The trachea is what to the esophagus? Anterior, posterior, inferior, or superior? Anterior. The windpipe is in front of the food pipe. Superior or inferior are incorrect because the trachea and esophagus run parallel to each other. The kidneys are what to the intestines? Posterior, anterior, superficial, or medial? Posterior. The kidneys are located behind the digestive organs. The liver is what to the diaphragm? Inferior, superior, deep, or posterior? Inferior. The liver is below the diaphragm muscle. It is also slightly anterior. The brain is what to the skull? Deep, superficial, lateral, or medial? Deep. It is located further inside the body and protected by the skull. The skull is the outer layer, and the brain is the internal structure enclosed within it. The abdominal aorta is what to the inferior vena cava? Posterior, anterior, lateral, or medial? Posterior. The main artery lies behind the main vein in the abdomen. The superior mesenteric artery is what to the superior mesenteric vein? Anterior, medial, lateral, or posterior? Anterior. The artery is typically to the left of the vein. It runs alongside. In the anatomical position, the palms face which direction? Anteriorly, posteriorly, medially, or laterally? Anteriorly. In the standard position, the palms face forward, and not just anterior because we're describing the direction the palms face. The great toe is what to the side of the foot? Medial, lateral, dorsal, or plantar? Medial. It is closer to the midline of the body. The little toe is what to the side of the foot? Lateral, medial, dorsal, or plantar? Lateral. It is further from the midline of the body. The top of the foot is referred to as what surface? Dorsal, plantar, anterior, or posterior? Dorsal. It describes the upper side of the foot, which is analogous to the back of the hand. The sole that touches the ground is the plantar surface. The sole of the foot is referred to as what surface? Plantar, dorsal, palmar, or posterior? Plantar. The plantar surface is the bottom of the foot. The palm of the hand is referred to as what surface? Palmar, dorsal, plantar, or anterior? Palmar. The palmar surface is the palm. The back of the hand is referred to as what surface? Dorsal, palmar, plantar, or posterior? Dorsal. The dorsal surface is the back, like the top of a foot. The superficial temporal artery is what to the temporalis muscle? Superficial, deep, medial, or lateral? Superficial. This artery lies above the muscle, closer to the skin. The femoral artery is what to the femur? Anterior, posterior, medial, or lateral? Anterior. The femoral artery runs in front of the thigh bone. The popliteal artery is what to the knee joint? Posterior, anterior, medial, or lateral? Posterior. This artery is located behind the knee. The adductor muscles are located on which side of the thigh? Medial, lateral, anterior, or posterior? Medial. They are inner thigh muscles that pull the leg toward the midline. The deltoid muscle is located on which aspect of the shoulder? Lateral, medial, superior, or inferior? Lateral. It forms the rounded contour of the shoulder, away from the midline. The diaphragm is what to the lungs? Inferior, superior, posterior, or anterior? Inferior. The diaphragm forms the floor of the thoracic cavity, sitting inferior to the lungs. The spleen is what to the stomach? Lateral, medial, superior, or inferior? Lateral. The spleen is located to the left of the stomach. It is also posterior. The appendix is located where in the lower abdomen? Right, left, upper, or central? Right. The appendix is found in the lower right quadrant of the abdomen. The gallbladder is what to the liver? Inferior, superior, posterior, or anterior? Inferior. It is located directly beneath and attached to the liver's inferior surface. The pancreas is what to the stomach? Posterior, anterior, superior, or inferior? Posterior. The pancreas is located behind the stomach. The urinary bladder is what to the pubic symphysis? Posterior, anterior, superior, or inferior? Posterior. The bladder sits behind the pubic bone. The triceps muscle is on which side of the arm? Posterior, anterior, medial, or lateral? Posterior. It is the primary muscle on the back of the upper arm. The biceps muscle is on which side of the arm? Anterior, posterior, medial, or lateral? Anterior. It is the primary muscle on the front of the upper arm. The flexor muscles of the wrist are on which side of the forearm? Anterior, posterior, lateral, or medial? Anterior. These muscles, which bend the wrist, are on the palm side. The extensor muscles of the wrist are on which side of the forearm? Posterior, anterior, medial, or lateral? Posterior. These muscles, which straighten the wrist, are on the back of the forearm. The heart is situated within what cavity? Thoracic, abdominal, cranial, or pelvic? Thoracic. The heart is located in the chest or thoracic cavity. The brain is enclosed within what cavity? Cranial, thoracic, spinal, or abdominal? Cranial. The brain is housed in the skull or cranial vault. The spinal cord is enclosed within what cavity? Vertebral, thoracic, abdominal, or pelvic? Vertebral. It runs through the canal formed by the vertebrae. The stomach and liver are found in what cavity? Abdominal, thoracic, cranial, or pelvic? Abdominal, which is the superior portion of the larger abdominopelvic cavity. A structure that is superficial to another is always what? Closer to the surface, further from the surface, closer to the head, or closer to the feet. Closer to the body surface. Superficial describes a position closer to the outside of the body. A structure that is deep to another is always what? Further from the surface, closer to the surface, closer to the back, or closer to the front. Further from the surface. Deep describes a position further from the outside of the body. The term ventral is synonymous with what? Anterior, posterior, superior, or inferior? Anterior. It refers to the front or belly side of the body. The term dorsal is synonymous with what? Posterior, anterior, inferior, or superior? Posterior. While dorsal originates from the Latin word for back or dorsum, it is also used in anatomy to describe the side facing away from the belly or towards the spine. The term cranial refers to a direction toward what? Head, feet, front, or back. Head, another term that means the same thing as cranial, is superior. The term caudal refers to a direction toward what? Inferior, head, front, or back. Inferior. Caudal relates to the tail or lower end of the body. The neck is what to the head? Inferior, superior, anterior, or posterior. Inferior. The neck is below the head. The nose is what to the mouth? Superior, inferior, posterior, or anterior. Superior. The nose is above the mouth. The clavicle is what to the scapula? Anterior, posterior, superior, or inferior. Anterior. The clavicle is in front of the scapula. The humerus is what to the scapula? Distal, inferior, posterior, or proximal. Distal. While the humerus is physically lower, we avoid inferior, since it is reserved for the main body axis. We use distal for limbs, referring to the distance from the trunk. The carpals are what to the humerus? Distal, proximal, superior, or inferior. Distal. The wrist bones or carpals are further from the trunk than the upper arm bone. The femur is what to the tibia? Proximal, distal, posterior, or anterior. Proximal. The thigh bone or femur is closer to the trunk than the shin bone or tibia. The fibula is what to the tibia? Lateral, medial, anterior, or posterior. Lateral. The fibula is on the outer side of the leg relative to the tibia. In the lower leg, the tibia is what to the fibula? Medial, lateral, anterior, or posterior. Medial. The tibia is on the inner side of the leg. The ulna is what to the radius? Medial, lateral, anterior, or posterior. Medial. In the forearm, the ulna is closer to the body's midline. The radius is what to the ulna? Lateral, medial, distal, or proximal. Lateral. In the forearm, the radius is further from the body's midline thumb side. The ilium is what to the pubis? Superior, inferior, anterior, or posterior. Superior. The ilium forms the broad upper region of the hip bone, while the pubis is located more anteriorly and inferiorly. The sacrum is what to the coccyx? Superior, inferior, anterior, or posterior. Superior. The sacrum is above the tailbone or coccyx. The manubrium is what to the xiphoid process? Superior, inferior, posterior, or anterior. Superior. The manubrium is the top part of the sternum, above the xiphoid. The hyoid bone is what to the thyroid cartilage? Superior, inferior, posterior, or anterior. Superior. The hyoid bone is located above the Adam's apple. The kidneys are considered what organs? Retroperitoneal, intraperitoneal, extraperitoneal, or subperitoneal? Retroperitoneal. They are located behind the peritoneal lining of the abdominal cavity. The small intestine is considered what organ? Intraperitoneal, retroperitoneal, secondary retroperitoneal, or extraperitoneal? Intraperitoneal. It is suspended within the peritoneal cavity by mesentery. The term ipsilateral means on what side? Same, opposite, upper, or lower. Same. Ipsilateral refers to the same side of the body. The term contralateral means on what side? Opposite, same, upper, or lower. Opposite. Contralateral refers to the opposite side of the body. An injury to the right arm and right leg would be what injury? Ipsilateral, contralateral, bilateral, or unilateral. Ipsilateral. It affects limbs on the same side of the body. An injury affecting both sides of the body is called what? Bilateral, unilateral, ipsilateral, or contralateral. Bilateral. Bilateral means affecting both the right and left sides. The axillary region is what to the pectoral region? Lateral, medial, superior, or inferior? Lateral. The armpit is further from the midline than the chest. The inguinal region is what to the umbilical region? Inferior, superior, posterior, or anterior? Inferior. The groin area is below the navel. The cervical region is what to the thoracic region? Superior, inferior, anterior, or posterior? Superior. The neck is above the chest. The lumbar region is what to the sacral region? Superior, inferior, anterior, or posterior? Superior. The lower back is above the tailbone area. The brachial region refers to what? Arm, forearm, thigh, or leg? Arm. The brachial region is the anatomical term for the arm between shoulder and elbow. The antebrachial region refers to what? Forearm, arm, thigh, or leg? Forearm. The antebrachial region is the anatomical term for the forearm. The femoral region refers to what? Thigh, leg, arm, or forearm? Thigh. The femoral region is the anatomical term for the thigh. Which structure is cranial to the spinal cord? Brain, heart, lungs, or stomach? Brain. The brain is cranial to the spinal cord, meaning it's located in a position higher up toward the head. What does the buccal region refer to? Cheek, chin, forehead, or nose? Cheek. The buccal region is the area of the cheek. What does the orbital region refer to? Eye, ear, mouth, or nose? Eye. The orbital region contains the eye socket. What does the nasal region refer to? Nose, mouth, ear, or eye? Nose. The nasal region is the area of the nose. The great saphenous vein runs how on the leg? Superficial, deep, posterior, or anterior? Superficial. It is a large, superficial vein close to the skin surface. The femoral vein runs how relative to the great saphenous vein? Deep, superficial, posterior, or anterior? Deep. The femoral vein is located deeper in the thigh. In the anatomical position, the fibula is what to the tibia? Lateral, medial, anterior, or posterior? Lateral. The fibula is the outer, non-weight-bearing bone of the lower leg. The knees are what to the ankles? Distal, proximal, posterior, or inferior? Proximal. The knees are closer to the hip than the ankles are. The abdominal cavity is what to the thoracic cavity? Posterior, superior, inferior, or deep? Inferior. In standard anatomical position, the abdominal cavity is located below the thoracic cavity. Inferior means a lower position.